A lot of people have not heard of endocrinology, but it is basically focused on hormones and the cool things that they do in our body. Sometimes we get too much hormones, sometimes we don't have enough, and the endocrinologist steps in and helps balance that out. So some things that you may have heard of would be thyroid disorders, diabetes, of course. This is America. We're just getting more and more diabetic. And but then things such as low testosterone and adrenal problems, pituitary gland problems. So glands people probably have never heard of can malfunction and really throw the whole body off. And that's where we step in and help. In medical school and training, every rotation I went on, I was like, this is it, this is my specialty. And then once I got to endocrinology, I never looked back. It really was it. I had some wonderful teachers. They were very passionate about it, and just the thought process and the clinical decision making that you have to do in endocrine was fascinating. And you can really help somebody instead of just putting a Band-Aid on a problem. You can cure them and fix their life. It's very exciting. I like to try to get the patient as excited about their health care as I am, because if you have an excited patient and you're excited, there's pretty much nothing you can't do, and everyone benefits from that relationship. So you've got to start with the doctor-patient relationship, and you just have to have infectious excitement for their health care. I would like new patients to kind of know that they are going to be getting somebody who is excited about their health care, and I like to see them as a whole picture instead of just labs and a piece of paper. You have to talk to them about their family. You have to talk to them about what they're going home to. So much is what's happening in their life. You spend time with them in the office, but then so much of what goes into their health care is what happens when they walk out of your office. So you have to know what that is. I went to high school at Farmerville High School, which is about an hour and a half away from here, and then went to Louisiana Tech for undergrad, studied chemical engineering. Thought I was going to do that, but then once I got the medicine bug, I decided to go to medical school, which was right here in Shreveport, LSU Medical Center, and stayed here once I got here. This is home now. So did medical school here, and then my fellowship and residency stayed right here in Shreveport. Being able to help people, truly help them on a daily basis is very satisfying. And you just get to see it every day. You see people get better. And that's why endocrine is so cool, is that it's not just about the chronic disease. You can fix the acute diseases.